Hello, welcome to this session on health assessment in non-college campus communities. Our speaker, Elder Varela, is a Ph.D. and graduate research fellow in the Department of Health Education and Behavior at the University of Florida. Her research interests include obesity prevention, nutrition education and behavior, policy, systems and environmental changes, social determinants of health, food security, underserved populations, and program evaluation. Please use the chat feature to interact with each other during this session, and you can type your questions in the Q&A tab for Elder to address at the conclusion of her presentation.
Hello, everyone. My apologies for not sharing my camera. I'm experiencing a little bit of tech difficulties, and we also have a weathering day here in Florida. But I'm really excited to be part of this conference and bringing you a presentation on the development and validation of a behavioral environmental perception survey for low-income communities. As mentioned, my name is Elder Varela. I am a doctoral candidate at the University of Florida, and today, the presentation outline will look like we're going to start talking about a little bit of background, followed by the rationale behind this study, as well as the overall objectives and the specific aims, and a detailed description of the methodological approach under the aims, followed by some preliminary results and discussion, and we'll wrap up with 5 to 10 minutes of Q&A. So with that, we're going to start with a little bit of the background. Obesity in the U.S. Is a major health issue that has been strongly associated with an increased risk of diet-related chronic diseases, including cardiovascular disease, type 2 diabetes, and certain forms of cancer. According to the 2017-2018 data from NHACE, the National Health and Nutrition Examination Survey, obesity affects 19.7 children and more than 41.9 adults in the United States. Oops. Economically disadvantaged groups are more likely to engage in unhealthy behaviors and also are at greater risk of experiencing adverse health outcomes. So understanding the environments where people live, eat, learn, play, shop, and how these settings can be beneficial or detrimental on their overall health is pivotal to identifying the barriers and facilitators to engaging in healthy, healthful practices. So while poor dietary behaviors, physical inactivity, and sedentary behavior are significant contributors to diet-related chronic diseases, access to those healthful foods and opportunities for physical activity and play are very important for an individual's engagement in health behaviors and lifestyles choices. So also financial trends to build environment and social cultural norms play an important role in increasing that sedentary behavior, poor diet quality, and mental health problems. So with that, let's do a little bit of discussion on the social determinants of health. So these are the social, economic, and environmental factors that impact the health and well-being of individuals. As illustrated in this image, the social determinants of health can be grouped into 5 domains. So these are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and the social and community context. So for instance, in the context of obesity, while poor eating habits, physical inactivity, and other related sedentary behaviors are significant contributors to obesity, we also have those social and environmental factors, such as cultural support systems and, those resources that make it hard for them to live a healthy lifestyle. So, exploring the relationship between an individual and the social context of the environment is very important to develop meaningful interventions in addressing obesity prevention and food security programs and policies. So how to address the social determinants of health? Nutrition education programs, including SNAP-Ed, FNAP, and other programs funded to the federal government or nonprofit organizations Deliberate nutrition programming comprised of evidence-based direct education, social marketing strategies, and policy system and environmental change approaches in different settings. So PSC, what we call PSC changes, those policy system environmental changes, are designed to promote healthy behaviors, but making healthy choices readily available and easily accessible in the community through activities completed in collaboration with different stakeholders. That could be the local, regional, or national level, with the goal of maximizing the impact. So as you can see in this image, there's 5 solutions for changing communities, and that involve those different settings. So integrating physical activity every day through parks and recreational facilities, activate employers and healthcare promotion. So having that worksite wellness programs in those work settings, also strengthening the schools, as those children, that's the heart of health, with children from 6 to 18 or even lower ages engage most of their days there. And then making sure people also have access to healthy foods in groceries and the food environment that is near their communities. So, just to get a little bit of definitions of the policy system and environmental changes, these are from definitions, operational definitions via SNAP Ed, so the Supplemental Nutrition Assistance Program, the education component. So, a policy is a written statement of an organizational position, decision, or course of action. And ideally, policies describe actions, resources, implementation, evaluation, and enforcement. And this is just an example. So, for instance, after consulting with the SNAP educators, local Boys and Girls Club amends a contract with the vendor so that healthier options are offered in vending machines. Systems are those unwritten, ongoing organizational decisions or changes that result in new activities, reach large proportions of people the organization serves. So those are system changes that precede or follow a written policy. And in this case, an example can be local farmers and grocery stores agree to collaborate in efforts to sell what they believe are ugly fruits, or those that are not appealing to consumers at a discounted price. And finally, the environment includes the built or physical environments, which are visual, observable, but may include economic, social, normative, or message environments, and modifications in settings where food is sold. So you have those social changes may include shaping attitudes among administrators, teachers, service providers. In a specific school meal program, or adding physical activity breaks, and so on. So an example is a community makes improvements to a walking trail in a low-income area to encourage more physical activity among residents. So the objective of this study is to develop and validate a behavioral environmental perception survey for individuals with low-income communities to determine their perceptions of the healthfulness of the environment. So the rationale behind this study is to be able to access other measurements about those policy systems or environmental changes to assess the healthfulness of the environment in these communities. So with that, the specific aim one of this study is to conduct formative research in the form of focus groups and or in-depth interviews to measure community perceptions on the environment support for healthful practices. And this is currently being conducted. We have already completed phase 1, which is focus groups with extension professionals, which are nutrition educators working with federal nutrition assistance programs in the target communities. We also have completed focus groups and in-depth interviews with community stakeholders. So those leaders of community organizations, directors of nonprofit, faith-based organization, administrators of government assistance programs, and those who provide services and resources to communities with low income and who partner with federal nutrition assistance programs. And lastly, we are going to move into developing or conducting focus groups with adults from low-income target communities eligible to receive that federal nutrition assistance or those nutrition programming. Because of COVID-19, we had to retest or conduct additional focus groups and interviews with our target population as COVID-19. We wanted to determine how COVID-19 had impacted perceptions about the healthfulness of the environment and healthful behaviors in urban and rural communities where people are eligible for nutrition assistance programs, such as, again, SNAP, FNAP, and WIC. The purpose was to expand the understanding of the needs of these communities within different geographical areas and different demographic groups. Also highlight program and policy implications related to the changes and modifications made in response to COVID-19, and to inform the need for adjustments moving forward for the next step of not only the survey development, but also moving through the recovery and new period that we left from experiencing the underlying effects of COVID-19. The last phase after the last aim, so after phase 3, the focus group with community residency is completed. Aim 3 will be to generate those items and test or pilot test the BEPS instrument, and then aim 4 will move into validation of the developed instrument. So for this presentation, I'm going to talk about aims 1 and 2. So how we conducted this was through, again, semi-structured focus groups, including 4 to 6 participants, as well as interviews. And these were based on constructs from the social cognitive theory. Participants for phase 1 included extension nutrition educators working in SNAP Ed and FNAP. Phase 2 consisted of community stakeholders, and phase 3, which we're going to start working on right now, is with community residents. The focus groups and interviews were about 60 to 90 minutes in length, and they were conducted either in person prior to COVID or via Zoom during COVID and as needed. For data analysis, this was a qualitative data analysis thematic approach. So how the process began is that we audio recorded the Zoom or in-person focus groups and interviews. We transcribed the data verbatim and extracted the data per question for analysis. We started the initial coding conducted individually by 2 trained researchers. So 2 researchers from the same institution went over the entire data set and coded the data independently, and then got together to identify what were those similarities and differences in that initial coding and discuss in order to reach consensus and complete that inter-rater reliability process. And then finally, also those coders identify the overarching themes that were generated from the categories that were gathered from the analyses. So I'm not sure if you can see the questions, but this is just some of the questions that were asked in the questions that were during COVID-19. So the general question that was the opening of the interview focus group was, what does lifestyle means to you? Then we move into the challenges and barriers they believe people in those communities experienced. And we use some proofs just to guide the conversation, just to describe a little bit more those challenges resulting from the pandemic, as well as discussing any of the major health-related issues in these communities and any other other factors or barriers that may have come up in the pre-phase of this data collection, such as For instance, cost, safety, environment, time, partnership. So something that I forgot to mention was that participants were matched. So we tried to collect data from the same participants that participated in the pre-COVID data collection and during COVID data collection. For those that were not able to return, we did conduct post pre type of questionnaire in which they had to reflect on how was the situation in their communities prior to COVID-19 and then resulting from COVID. We also asked them about any opportunities in these communities to receive information to address those challenges, as well as what is the most important thing that could be done to improve the quality of life for the entire community. So here are some preliminary results from AIM 1 and 2, specifically related to nutrition educator perceptions before and during COVID. And for this question, or for this summary, I'm just going to focus on one question only. But a total of 97 nutrition educators participated in focus groups and interviews prior to COVID-19. A total of 77 nutrition educators participated during the first 2 years of the pandemic. So about 75% of the participants returned to complete the post questionnaire interview session. One thing that I forgot also to mention is that this was conducted across the nation in 11 states, including Florida, Kansas, New Hampshire, Rhode Island, Tennessee, West Virginia, and South Dakota. I'll probably maybe forgetting a couple of them, but these are part of our multi-state research team, the one that is hosting this conference. So the question that we're going to be going over today is, what are the challenges or barriers in your communities that interfere with living a healthy lifestyle, as you described again in the previous question? So results about the barriers. Prior to COVID-19, nutrition educators mentioned that lack of or limited access to availability of healthy and affordable foods was definitely a challenge for them to engage in healthful practices. Lack of transportation, lack of limited health related and nutrition knowledge, financial insecurity, lack of safety, poor design built environment, lack of motivation or resistance to engage in healthful practices, lack of community buy-in or community engagement to support healthful practices, challenging social environment, and lack of limited access and availability to various community resources such as mental health, childcare, and housing were those definitely barriers or challenges to engaging in healthful practices and behavior. Here are a couple of the quotes that we gathered from participants. So regarding lack of or limited access to healthy and affordable foods, this is a direct quote. They have moms and pops and Family Dollar, Dollar Tree. Those are around. The quality is just not there. You don't have any fresh fruits and vegetables. Regarding lack of limited access to transportation, one participant said a lot of them don't have cars, so they have to walk to the grocery store and carry everything back. So it is the safety of that. Lastly, one other participant said lack of community resources, specifically regarding mental health. Mental health is high with young people committing suicide. I think we need more resources. So we asked the same question, but now during COVID-19, and these were the responses. So the pre-COVID-19 barriers pretty much were reported again. However, this time they mentioned that they have been exacerbated by COVID-19. They also mentioned COVID-19 restrictions such as social distancing, shutdowns that happened from the onset of the pandemic, creating barriers to engage in healthful practices. Also, COVID-19 impact on diet, physical activity, and mental health attitudes and behaviors. Also, the fear related to the COVID-19 exposure, so getting exposed to COVID-19 and experiencing the symptoms of the disease. Food distribution pickup challenges, so they mentioned the long lines or not being able to make it to receive the available food packages distributed to them. Also, increased job insecurity and limited job opportunities during this time, lack or limited access to technology and internet connectivity issues, and lastly, restrictions with available local, state, and federal assistance. So with that, I also have a few quotes. So during COVID-19, again, this will be for lack of or limited access to technology and internet connectivity issues, as well as COVID-19 restrictions. So one participant said, people might not have internet or access to technology, and if homeless, they might not have a phone or computer to access services like telehealth, but then they also don't necessarily have access to in-person things because of the restrictions. Now, regarding restrictions with available local, state, and federal assistance, one participant said people who are out of work but household income makes them ineligible for a SNAP and other benefits. That makes it harder. That makes getting food in general a challenge. People falling into the gap are suffering. And lastly, an example of a participant mentioning the increased job insecurity and limited job opportunities. Parents have lost their jobs due to COVID, whether they got laid off or fired or they are getting furloughed. So a little bit discussion about those findings. The COVID-19 pandemic, as you all know, drastically affected many communities, specifically regarding the social and physical environments, exacerbating not only the existing barriers, including lack of transportation or lack of access to healthful foods, and as well as access to recreational centers, but also created new challenges for individuals to access those healthful foods, physical activity resources, and mental health supports. Again, a lot of the things that participant mentions were around the food pantries and how, well, there was a lot of opportunities in that area. There were also a lot of restrictions, as well as not being able to go to work or having to prioritize between having to stay home to provide childcare to their children or having to be able to go to job to support their family, and also being exposed to the disease and having to have that balancing act. That was also affecting not only their access to resources, but also their mental health and other physical related health of themselves and their families. So as community started rebuilding the lives after COVID-19, it is important that researchers, practitioners, and community leaders like ourselves come together to evaluate the needs of these communities. So establishing those community partnerships to design interventions and to address inequities and improve the health status, focusing on those social determinants of health is pivotal. So one of the things that we're going to be doing for this specific study was to gather those perceptions and thoughts from those community residents to understand what do they think are those barriers and opportunities, and what would they like to see to improve the healthfulness of their environments, and compare what are those perceptions between those different individuals that we have gathered to see what is the need out there, and also inform the development of our tool. So again, future research to be conducted to identify any potential differences from community members and other key stakeholders that may aid in developing and implementing programs and resources for this community. So At this time, I will take some questions. I apologize. I had to cut my presentation a little short, but I didn't want any technical difficulties not being able to um, talk to you all today.
Elder, thank you so much for that great presentation. It doesn't look like we have any questions at this time, so um, I guess we will end the presentation. And just remember, the next session coming up is an activity break to be followed by research tool presentations. Join us back in the main stage by clicking the black box in the upper right corner of the screen once we end this presentation. Enjoy the rest of the conference.